Hi everybody, this is Leslie Kuhnel and I am going to be spending the next hour or so visiting with each one of you and talking with you about ethics in your role of Faith Community Nursing Network. I'm really sorry I can't be there to share this afternoon with you. This is one of my favorite events to do during the year, and unfortunately I'm away at a conference today. But Ronette and her team are willing to let me try a little technology here to share with you a little bit of a virtual presentation. So I'm going to go over a few things that you've got on your handouts here and spend some time with you. We'll trigger some discussion questions and things like that, and I ask your patience with me as we bear with this kind of homemade video program for you. As we get started, we're going to take a look at the slides, and I'll try to give an indication of when I'm moving on to the next slide. Hopefully that'll help us kind of go through the program a little bit and give you a chance to talk about some things as well. As I mentioned, I visited with Ronette a little bit, and we had talked about one of the things that I'll miss is hearing your stories and kind of responding to questions that you might have. So if you do have questions that come up or things that I can help you with either now or anytime during your Faith Community Nursing Network work, feel free to give me a call. I'll have detailed information for you, contact information on your handouts, as well as information that you'll find on the cards that we'll hand out to you, little pocket cards. Now this is a service that you've got available to you. Between that, our ethics education programs, we want you to really feel free to access the services of the Ethics Center here at Allegiant Health anytime you have need for assistance, or we can just kind of help you work through those tough cases. Okay, let's go ahead and get started. I'm going to just start with the objectives of the program to kind of get us focused on what we're going to be looking at the next hour or so. And what we'll go over today are, we're going to talk a little bit about issues, ethical dimensions that you might see in your Faith Community Nursing Network practice. We're going to describe some elements of ethical decision making, talk about some frameworks you might want to use as you are working through programs. We're going to describe a method that you might use, or at least one that I use and find helpful with my teams, to do some ethical analysis and a framework in which you can look at those complex cases, kind of give you a sense or a tool that you might be able to use. And then we're going to do some case studies. We're going to hear those based on what you have, the things that you've run across. We're also going to use some of the case studies that you've got prepared and in your handouts to kind of give you a sense of what to talk about. And we'll move through it that way. If you look on the first, the slide number 3, the first kind of slide after the objectives, I want to start by talking with you a little bit about ethics in the context of faith traditions. As you know, at Allegiant Health, we're both sponsored by Lutheran and Catholic traditions, and we look to that Christian faith tradition to give us a framework for how we look at ethics, how we look at complex cases, kind of that basic groundwork, and I wanted to go over these with you. Now, I do want to note that we know that not all of us are from that Christian faith tradition. In our patients that we serve, in the people who serve our patients, and the people that we work with, and certainly even in our Faith Community Nursing Network, we see all traditions as equally important in taking a look at things. And so as I go over these Christian faith traditions, the pieces that are most grounding to us, that most inform us of our ethics in our care delivery, I want you to also be thinking about similarities these might have with other faith traditions. And I think you'll find, for the most part, when we look at things that are based out of this ministry of healing or that are out of this common ground, that's what we find. We find this common ground of looking to people and looking to meet their needs. And so a few of the things that we're going to go over in the next few slides. For example, one of the big things that we start at as we look at this particular context, this faith tradition, is how we love and care for one another. And you can relate that in an ethics term, even as that term for respect for persons or respect for autonomy. It's really about how we relate to, love, and care for one another. There's also a sense of social justice that are common in our Christian faith tradition, but certainly in others. And that's that sense, if we put it into a particular applied way, of looking at access to health care, at distribution of scarce resources, at being able to see what are our communities that aren't served or that are underserved, and how can we improve access and a fairness of care delivery within the context of that system. And this can be looking at the community-wide level, the neighborhood level, even in your own faith community community level or your family level, to be thinking about how is it that we make these decisions, that we look at the resources that we've been entrusted with, and that we look to put that into practice in a way that makes sense from a social justice perspective. In ethics parlance, that framework is about justice. Some would say fidelity, and we'll talk about that in a little bit further on in our program. If you go to the next slide, that's slide number 4, you're going to see this continued, this list of different contexts and faith traditions. Another concept we have is advocacy, advocacy on behalf of others. If you relate that in some ways, you can think about the ethics perspectives or the principles of beneficence and non-maleficence. Beneficence being that term, and non-maleficence another term that I can never say until I have multiple cups of coffee, and I'm excited to be able to say on video as well. Beneficence being that phrase that really means that we want to do good, that we want to say that whatever the outcome is of whatever action we take, that we've created more good than burden, more benefit than burden. Beneficence. Non-maleficence, on the other hand, kind of a partnering principle, is that idea or that promise to first do no harm. We want to prevent or at least minimize harm as much as possible. So how do we look at ways that we inform people and what they do so they know what to expect when they're getting that blood draw or when they're getting that blood pressure? We're talking with them about what's going on. That we want to minimize things and eliminate harm as much as possible. Now we'll talk about this a little bit later on about what these kinds of things mean and how that can create a dilemma. But that's really one of the ways I wanted to relate this faith tradition framework with our ethics, is to look at that idea for advocacy on behalf of others. Another way I can think about that that's not necessarily on your slide but I think is really important is how do we serve as the voice for people who may not have a voice? So how do we advocate for people that aren't used to navigating a complicated healthcare system, that have never dealt with a sick relative or an infirmed spouse, or have never dealt with an illness, or don't know what to do when they're exploring their options, not even sure what kind of language we're using as healthcare providers? How do we advocate for groups to be able to make sure that their voices are heard and that they have a way to get resources and information that they need in order to make the decisions that they'd like to make related to their care? The second bullet on that slide is along with the concern for suffering and healing. And concern about that is focusing on the sense of suffering, of the experience that we have in the human condition, of understanding that it is complex and it is full of all kinds of things that we face, some that are very, very difficult and some through which we do suffer. That being part of this human condition, there's also that sense that we have a way to heal through and from that suffering. And together, this kind of work that we do with Faith Community Nursing Network and the work that we do in our healthcare ministry is to figure out how do we bring those things together, this suffering and healing, bring that together in a way that makes sense for the best of this particular patient and those that are involved in the care. The last bullet on that particular page is about morality expressed or lived out when addressing these concerns. You might be able to think about this, and I know morality can be a really kind of a tough word to get your hand around, but it's that sense of basically thinking about how is it that we abide by or work within a particular set of shared values, beliefs, a sense of being able to stay within the teachings of either our sponsors or our faith communities, or within the set of guidelines that we might look to, that we live up to these standards that we have. One way we might want to think about this is the idea of fidelity to promises. How are we faithful to the promises that we make to each other? Whether that be a promise to care for healthcare needs, or to be the voice for the underserved, or to engage with trust and with a belief in each other that we can provide support and learn and grow from each other. That kind of sense of framework by which we live our lives and do our work, that morality that we do, is really a part of that faith tradition that we have. I'm going to pause here for just 1 second and give you all the chance to kind of discuss and have some dialogue around this idea of this framework, and we'll be back in just a minute.